I'm Robert Klitzman. I direct the Masters of Bioethics program here at Columbia. I say here at Columbia metaphorically. Columbia decided about a year ago to open up a space in California here in the Bay Area because the second largest number of Columbia alums outside of New York City are in the Bay Area. And we have had various programming for alumni here, and the university chose a few areas to have some specific programming, one of which is in bioethics. We're delighted they decided to do that, and so we've had a series of open events such as this, and just FYI, we also distribute information. We have a online-only master's program, which is very interactive online, where everyone uses Zoom, and we have some of our students here. Some of them are meeting for the first time in person, having just seen them online. And we also have had a program here where we have classes here for a few days each semester and the rest being online. And we'd be delighted to tell you more information about that if you're interested. This evening, though, we are delighted to have a wonderful discussion panel with Margot Kushel, who is a professor of medicine in the Division of General Internal Medicine at the Zuckerberg San Francisco General Hospital and Trauma Center. She's also the director of the UCSF Center for Vulnerable Populations. She has worked extensively on ways of reducing the burden of homelessness on health, doing much amazing research through NIH grants. She's worked to help develop programs and policies to end homelessness and has explored the complex interactions between health and housing. She's received many grants and awards. She also directs the UCSF Primary Care Research Fellowship, and we're deeply honored to have us with us. Also, Tomiquia Moss, we're delighted to have with us. She is the founder and CEO of All Home, which works with CBOs and public and private sector players. She's locally and nationally recognized as a dynamic nonprofit and public sector leader with expertise in housing, public policy, and community development. Ms. Moss has served as a CEO of Hamilton Families, which has worked to offer emergency transition and permanent housing services. Before this, she served directly under the mayors of both San Francisco and Oakland, serving as chief of staff for Oakland Mayor Libby Schaaf. She's also been the executive director of the Hope Initiative and has done much amazing work. Was a project director of the San Francisco Community Justice Center of the Superior Court of California. So we thought this would be an interactive session. I thought the two speakers would maybe speak for 15, 20 minutes each about their perspectives on these issues in ways that ethical and public policy perspectives might move us forward. And then we'll have a chance for questions and answers. So please join me in welcoming our wonderful panel.
Yeah. Okay. Tamika and I do this a lot, so we just who's going first today? So thank you for having me. I'm Margot Kushel, and I am a physician, and I practice at San Francisco General Hospital, and that is what really inspired me to do work on homelessness, which I have been doing since I did my residency. I came out to the General in 1995, having just finished med school, fully intending to work on issues of the working poor. And I got out to the General and quickly noticed that on the internal medicine service at any given time, half of the patients that we were caring for were experiencing homelessness. And at that point, that was pre-duty hour work restrictions. So we were working, I would regularly do 30-hour shifts and go home for a few hours and come back in and do another 30-hour shift. And really my job started to entail admitting people to the hospital. They would be incredibly sick. We would spend all manners of money, and we would know, you have your hand up? Yeah. Speak up a little bit, yes. Sorry. Thank you for letting me know. Tell me if you have trouble hearing me. We would spend incredible amounts of resources and time and care, and I would be asked about what was the 15th thing on the differential diagnosis of medium vessel vasculitis or whatever other things that internists do. And then they would maybe come out of the ICU and be on the regular floors. I would take care of them, and then eventually and usually a nurse from utilization review would come by and say they no longer meet inpatient criteria and you need to discharge them. And there would be me as a, new doctor in my late 20s having to walk up to the patient and say, I'm sorry, I have to discharge you. And the patient would beg me not to send him or her back out to the streets. And they would say, please, doc, don't do this to me. It's cold out there. It'd be a day like this, or it's raining out there. And eventually I would be forced basically to discharge them, which often involving institutional police, to walk people to the elevators. And then, in those days, you admitted patients every 3 or 4 days, and you had as many patients as you admitted would be your patients until they were discharged. And if the patient came back within 3 days, they came back to your service. So we always knew exactly who was coming back to the hospital. And inevitably, within 2 days, my pager would go off, and they'd be like, hey, Margot, that guy you discharged 2 days ago, they're back. And I would go back to the emergency room and start the whole cycle again. And this light bulb went off in my head saying, like, this is not why I became a physician. We're not doing anything of value for these patients. There's nothing that I'm doing. There's no amount of awesome, high, intensity medical care that I'm doing that's advancing their health or their life or their well-being. It was morally incredibly distressing. It was extremely distressing as a healthcare provider to be the one to have to be on the front lines and breaking the nurses. It was just news to them. It was incredibly distressing to the nursing staff who spent a lot more time with the patients than I did. It was incredibly distressing to me. And I just thought, like, this doesn't actually make any sense. And I actually retooled what I spent the rest of my career doing to say, like, there has to be a better way to do this. So and look at what a great job I've done, because now homelessness is so much worse than it was. Clearly, I'm not very successful. I made it even worse. But it could have been worse. Thank you. But I think that the main messages that I would want this audience to hear is a couple things. One, we now know, and we've sort of always known, but we really know this problem is entirely solvable. Two, it's entirely an issue of long-standing policy failures, starting at the federal level. Three, not that it has nothing to do with mental health or substance use, but it has almost nothing to do with mental health or substance use, despite what your eyes tell you, that this is a problem that has its roots in really 3 main things. Crushing income inequality, structural racism, and the incredible lack of deeply affordable housing, or what we in the field called ELI housing, or housing that's affordable to people who make less than 30% of the area median income. That is what this problem is about. There is a straight line from the deep entrenched racism in the society to the experience that we see in the cities and the counties, and that problem is not unrelated to the fact that we have such a deeply low amount of ELI, what we call ELI housing. So ELI housing is housing that someone who makes less than 30% of the area median income can afford by spending less than 30% of their household income on it. Because what we know is that if you spend more than 30% of your household income, particularly if you're very poor, like I could probably spend 35% of my household income and be fine, because there's only so much food you need to eat. But if you're very poor, if you spend more than 30% of your household income, you're not having any money left over for food, for healthcare, and nothing for savings, and you're kind of one tiny disaster away from homelessness. Just to give you some sense of the size of the problem, in the United States right now, there are an estimated 35 units of ELI housing for every 100 ELI household. And in California, there are 22 units available and affordable for every 100 ELI households. And if we don't solve that problem, we don't solve this problem. To talk about the issue of racism, first of all, the obvious that people who are homeless, people who are Black Americans are at about a 3 to 4-fold increased risk of homelessness in this country. So nationally, about 11 to 12% of the population identifies as Black American, and 40% of those experiencing homelessness do. In San Francisco, fewer than 6% of San Franciscans identify as Black American, and 37% of people experiencing homelessness do. And that should shock and shame every single person, and particularly those of us like me who walk around with white privilege and have been on the like undeservedly good end of that, of that racial good end, meaning privileged end of that, of the issues with white supremacy policies, white supremacist policies. I mean, just to think about it, when you realize that until recently it was perfectly legal to discriminate against Black Americans in the ownership of homes. You've probably heard of redlining. And so basically Black Americans were not allowed to live in certain neighborhoods. And the banks basically said if you lived in a neighborhood that Black Americans were allowed to live in, we don't give mortgages to those areas. That was one of the reasons why Black Americans have so much less family wealth. There are other reasons too, but one of the main drivers of the disparate amount of family wealth, that household wealth, that white Americans have so much more wealth than Black Americans do, that even though there are now fair housing laws on the books, they're not that well policed, or police is probably the wrong word, enforced is the better word. And so we know that if you show up with the same housing resume, so you have you have the same number of kids and the same income and the same number of evictions, and you show up and you present to a landlord and you're white, you're much more likely to get the housing than if you're Black. Mm-hmm. So you add to that all the discrimination in the criminal justice system and educational system, which of course goes with housing. It's perhaps not a surprise that we have this huge disparate representation of Black Americans. So the question that always comes up to me as a physician, I think people say it to everyone, but perhaps they say it louder to me because I'm a physician, is this is all about mental health and substance use. I look on Market Street, I see people who've got mental health and substance use. So first of all, yes, no question that if you have a mental health or substance use disability, and just so you know, that's how I think of those conditions. I think of them as brain conditions, just like cancer is a bodily condition. Usually it's a condition that, like most diseases, has a genetic component, has an environmental component, has a component of exposures and environmental things. What it is not is a moral failure. I do not see either mental health or substance use as moral failures. I see them as problems that arise often in response to trauma. That if you have those disabilities, you're much more likely to become homeless. And when you think about it, it makes sense. If you have those disabilities, sort of everything is harder, right? Your ability to get a job, your ability to work, your ability to stay out of the criminal justice system, all of those things are much harder. So there's no question that if you have those disabilities, you're much more likely to be homeless. But I want to remind you that most people with those disabilities are housed, and there's nothing about those disabilities that means that you can't be housed. Some people need more supports. I have a physical health disability, and I trained in a wheelchair, and I often use crutches or canes, and I can't really do stairs. So for me, my disability accommodation are ramps and elevators. Someone who has a mental health or substance use disability needs accommodations for those disabilities, but it doesn't mean they have to be homeless. And in fact, we have empirical evidence to prove that. There's an intervention which we call Housing First, permanent supportive housing. You hear both of those terms. Has anyone heard those terms before? So when I started out in this work, we had this theory that the way people got housed if they were homeless was they worked their way up. They started in a shelter. If they behaved really well, they would be offered transitional housing for like a year or two. If they behaved really well, and by behaved, I'm putting that in quotes, but that means basically they were sober and they took their psych meds and they went to their psych appointments, they would be granted housing. And what we found is that worked fine for about the 5% of people for whom it worked for, and everyone else it didn't work at all. And so sometime in the mid-90s, actually taking the lesson from what we learned about assertive community treatment, which is a way that we take care of people with severe mental illness in the community, that script was flipped. And there was a decision to actually do something called Housing First, where you start with the housing. And then once people are housed, you can talk to them about their mental health issues or their substance use treatment. And actually, ironically, San Francisco was one of the 3 cities that was really at the forefront of this movement. In the late 1990s, Mitch Katz, who was then our director of public health, basically said, I'm housing people in the hospital. It doesn't make any sense. Why don't I house them in the community? And he opened the first Department of Housing within a Department of Public Health anywhere in the country. And they brought on Housing First in a big way. It is incredibly successful. Some people will say to me, like, why doesn't San Francisco do what Utah did? Utah copied San Francisco's model. It just turns out it's a heck of a lot easier to build housing in Utah than it is in San Francisco. But what we've shown, and I can give you an example, I just did a study, I'm just doing a study in Santa Clara County, where Santa Clara County asked us to find them their 400 basically most problematic, disabled, group of folks who are chronically homeless. So they wanted us to identify the folks who were causing the most havoc in the system. And we basically came up with a model where we found them, the 400 people. These are folks who had, to get into this group, you had to have like 4 hospitalizations and 3 jail stays, or 10 emergency department visits and 3 psychiatric emergency department visits and 1 jail stay. Like there were a bunch of criteria you could use. And we had 122 units of housing for permanent supportive housing to offer these folks. And we did. And we randomized them because we couldn't really decide between the top 400. So basically, of the folks randomized to housing, 85% were able to be housed, and those folks spent an average of 90% of their days housed over the next bunch of years. So that isn't everybody, but this is like the top 5% of the most impaired folks. Beyond that, it gets a lot easier, right? And in that group, 85% were housed really successfully. What permanent supportive housing is that you start with a housing, no preconditions, no expectations that people are sober, no expectations that people are involved in any mental health care. They get deeply subsidized housing that they can afford. Most people do PSH so that if you have benefits, let's say disability benefits, the payment, you pay 30% of those benefits towards the housing, and that gets taken off the top, and then the rest is yours to spend. You welcome people into that housing, and then you provide them with services. So in the Santa Clara model, there were teams led by licensed clinical social workers who worked with bachelor's trained case managers, as well as with peer case managers, people who had lived experience. And those teams had about a 1:15 to 1:20 ratio, where they worked and they provided the folks whatever they needed. Some folks needed help in, how do you get used to being in an apartment? How do you shop? How do you cook? Or they were there to provide brief interventions for mental health care, and they connected them to services. Oh, you haven't been to the doctor. Other than the emergency department, let me introduce you to the doctor. I'll even take you to the doctor. Let's go to the doctor together. And what we found is that people were housed really successfully. We definitely saw a decrease in psychiatric emergency department visits. Unlike all the hype that you'll read in the newspapers, no, it didn't save millions of dollars of healthcare, because guess what? This community is both overuses the ED, but they also are very sick, and they're actually underusing a lot of other services. So guess what? They were found to be sick and they got health care. But it was incredibly successful. And if you can house 85% of the people in this group, you can house just about anyone. What we also know is that of everyone who becomes homeless, probably only about 10 or 20% need that level of service. Most people just need housing that they can afford. They just need to close that gap between their income and what their housing costs, and there are a variety of methods to do that. Mostly we need to bring down the cost of housing, but now there's lots of talk about, Tomiquia, maybe we'll talk about rapid rehousing and other interventions that we have. So I would say of everyone who becomes homeless, maybe only 10 to 20% are in that group. And at any given time, about half of people who are homeless are in that group, because if you're in that group and you have those disabilities, you stay homeless longer, so you're more likely to be homeless in any cross-sectional survey. But don't let anyone tell you that, like, oh, we need to rebuild the mental hospitals. Like, people blame homelessness on the deinstitutionalization of the chronically mentally ill, and I have 2 things to say for that. One is that isn't literally true. Like, those folks are unfortunately long gone, and it's not really about that. But 2, deinstitutionalization was exactly the right thing to do. I have a disability. I identify as part of the disability sort of community, and I believe wholeheartedly that everybody has the right to live in the least restrictive environment that they can live in. And that has been held up by like the Olmstead Act from the Supreme Court, that everyone has the right to live in the community in the least restrictive setting. Deinstitutionalization was exactly the right thing to do. The only thing you can't do is deinstitutionalize people and not give them any other options. The whole idea with deinstitutionalization is you would take the money that was being used and transform it into assertive community treatment, which was sort of hospital without walls. One of my greatest privileges as an internist is I do the internal medicine or the physical health care for a cohort of patients who are in assertive community treatment programs in San Francisco. And I take care of folks who spent 10, 15, 20 years of their lives in Napa State or other long-term institutional settings. With their assertive community treatment, they're given housing and they're given the care that they need, a case manager, a psychiatrist with not a huge caseload. And they live lives of tremendous dignity and they have incredible bravery. And I love getting the privilege of getting to care for them. And their lives are difficult. Their brain is wired entirely different than most people's, and they certainly have struggles, but they live with great dignity. And that's sort of what is the ethical thing to do. And so I get really upset when I hear people say, we should just conserve everyone and put them in the hospital. There was a good reason why we deinstitutionalized people, and we don't want to go back there. We can create opportunities for people to live in the community, and we have plenty of evidence that it works. The only thing we lack right now is the political will to create the extremely low-income housing and the sort of political will to do that. So maybe with that, I'll turn it over to Tomiquia and let you take it up.
I mean, what else is there to talk about?
We're done.
It's all resolved. You heard everything
Good.
from Margot.
Done and done.
Well, good evening. How are y'all doing? Good. Well, thank you so much for having us both. And, part of the reason Margot and I tag team on these is because I think it's really important to sort of get a foundational understanding of this issue and recognizing that it is both complex and also very simple. Relative to the solutions that we need to bring to the table. So I'm going to just complement what you've heard so far and talk very specifically about some of the work that we're doing to really focus on bringing a regional lens to this work. I'm also going to talk a little bit about the cost of housing. Margot sort of described both why it's so difficult for us to figure out how to build more extremely low income housing that really poor people can afford. Most people can't afford the Bay Area. It is increasingly getting to be a place of the haves and have-nots. And unless we intervene and figure out how to actually address our housing construction costs and the housing regulatory framework in the state of California, this is just the beginning of how bad it can actually get. So I just want to have a little bit of a reality check around the cost of housing. And then I want to talk a little bit about some of the connections that we're making around what it means to actually make sure that people are securely housed, as well as have a social and economic sense of security, so that as you begin to not worry about whether or not you can pay your rent and you're employed, how do we actually create ladders of opportunity within people's employment pathways to actually expand their wealth and their income? So I'm going to start a little bit with the cost of housing. So San Francisco in California is one of the most expensive housing markets to develop housing in the world. There are very few places globally that it costs as much per unit to develop housing. And the uniqueness of San Francisco and the Bay Area is that it doesn't cost any less to build an affordable housing unit for people with lower incomes than it does with people with higher incomes. So when you are on average paying about $650,000 per unit to develop the housing, that is from soft costs, construction costs to the time that the unit becomes online, investors, even if you are doing affordable housing, which are tax credits and many of the financing tools that affordable housing developers use in the Bay Area to build housing, you still need to be able to have rents that actually cover the cost to operate the building. So if you are an affordable housing developer, I started my career here in the Bay Area working for the Tenderloin Neighborhood Development Corporation. Who's heard of TNDC in the room? Anyone? Uh-oh, hey. Hi. Oh, yay. I love your green, by the way. So TNDC is an affordable housing developer in the Tenderloin neighborhood, which owns and operates almost 3,500 units of affordable housing for folks who earn zero up to about 60 to 80% of area median income. So most of our development community is providing the affordable housing development community is really who builds the housing that we're talking about today. And when I started my work out as a social worker, working in the buildings and the Tenderloin and supporting those residents, these residents were really poor and they were paying rent. And most of my job was to ensure that the tenants did not lose their housing because of all of the other challenges that that were, interrupting their lives because of both poverty and everything else that was going on. So when you think about people who are unsheltered, that is a crisis that we have to tackle right now, and we need to figure out what do we need to do to bring people indoors as quickly as possible to mitigate some of the things that Margot talked about. But what I'm focused on also are the people who are precariously housed, those who are really on the brink of homelessness with one financial disruption and really sliding into homelessness faster than we can rehouse those who are currently unsheltered. So right now, when I was running Hamilton Families, where we support families experiencing homelessness, by the time a family got to our programs, they were already experiencing episodic homelessness. They were sleeping on couches, they were moving a lot, incomes were precarious and unpredictable. And so by the time we were able to rehouse those folks in the same time period, throughout the entire Bay Area, 2 more families would become homeless in the same time period. So unless we start to complement what we're doing for the unsheltered crisis across this region and what we need to be looking upstream to disrupt those who are most at risk and prevent homelessness where possible, then we are not actually solving the right problem. So I formed All Home to really look at that very intersection of how do we support our public sector partners to really have a comprehensive emergency response to our unsheltered crisis across both at the local level, at the state level, and frankly at the federal level. Our tax dollars really should be supporting our most vulnerable residents in our communities. And if we need additional supports like we do from the private sector as neighbors and citizens of this region, we need to then leverage those resources so that we can have deeper impact across the economic spectrum. So right now, in order for the only extremely low income housing that we build in the state are for people who are currently experiencing homelessness. Mm-hmm. So that 0 to 30% AMI is really designed around the permanent supportive housing model that Margot mentioned. High need, high touch, intensive services, permanent housing options, really for people with disabilities. And what Margot described is that that's about 10% of those who are experiencing homelessness right now. But the rest of the people, which we are concerned about, don't really qualify, frankly, for the existing supportive housing model that exists. So if a person becomes homeless in San Francisco, but they're not yet on the street, they cannot go to an access point right now and get into the homelessness system because the system is really designed to deal with the most acute, long-standing chronic homelessness, which is necessary but not sufficient. So what we're trying to do is create a continuum of support that customizes services and resources according to what people actually need. So folks actually need really cheap housing. And what we started seeing is a mass exodus out of San Francisco as far as Sacramento, Fresno, Stockton, to find that affordable housing. But what we also saw was that the community connections that people had where they were living, generations of their families, their church home, their kids' best friend, all of those folks were in San Francisco. So when you move to Stockton and you have an affordable home, that's not enough to feel that fulfilled, thriving life that we all seek toward. So part of our work is to try to create regional solutions that help all counties actually do a much better job coordinating our system of care so that if you become homeless in San Francisco, you move to Oakland and you still need supports, the system actually allows for that support to happen across county lines. Right now, we don't have data systems that share data across counties in terms of if Margot, got into the homelessness system in San Francisco, I wouldn't be, and we rehoused her in Oakland, and she had another financial emergency and ended up needing some support, there would be no way for me as a provider in Oakland to know what was going on for Margot when she came from San Francisco. So we think that approaching this from a regional perspective allows us to both recognize that people are mobile. This is a connected region. Our economies are connected. Our transportation, albeit crappy, is regional. Like, how in fact do we create approaches and solutions that it doesn't matter what county or city you originated in terms of your crisis, you will be able to access whatever opportunities that you need to stabilize and to thrive. So we believe that taking a regional approach, and when we say regional, it really is sort of focusing on the 9-county Bay Area, consistent with how the Bay Area's funding processes go in terms of its transportation resources, as well as ABAG and MTC, which are really the sort of only regional formal infrastructure that the Bay Area has in terms of resource sharing and so forth. There's an opportunity that came out of the legislative process this last cycle with David Chu leading the charge on a very aggressive housing package. I was a part of the Metropolitan Transportation Commission put together a housing group. We worked together for about 18 months to come up with a compact that we then submitted to the state legislature and the governor to really advance a housing agenda for the state of California. And it expanded from protections for existing tenants who are being displaced out of their communities rapidly. Just to give you a very real example, when I was chief of staff in Oakland and the mayor and I put together a housing agenda for the city, it was a 5-year housing agenda, building new housing, preserving existing housing, etc. Homelessness wasn't even in the top priorities of that housing agenda, and that was just 4 years ago. So the rapid nature of people becoming unhoused is really unique depending on the jurisdiction that you're in. San Francisco, homelessness has been pretty persistent as a challenge for a really long time, but communities like Oakland and Contra Costa County, San Mateo County, unsheltered homelessness is a new phenomenon. So there really isn't a lot of administrative infrastructure to really figure out, okay, what are the ways that we need to apply housing first principles, for example, to solving the unsheltered crisis, or how do we prevent homelessness from happening in the first place? There's not a lot of bench strength in a lot of our jurisdictions across the counties to figure this out. So All Home is really trying to both bring best practice and research. We are partnering with Margot on sort of a research agenda of how do we use what we know works and scale it? How do we do demonstration projects and pilots to really help communities tackle the crisis that they're in, but also be much more strategic about the impact that we're trying to have and developing a set of shared outcomes. We really haven't operated in this space driven by outcomes. It's really been sort of a maintenance approach. For as many people come into the system, we're going to figure it out, right? We've never actually felt like, from my perspective, that homelessness is solvable. And that's why Margot and I are so dogged about the fact that this is not an insurmountable problem, especially for the 5th largest economy in the world. We can do better. But we need the political will. We need strategies that work. We need strategies that can be scaled both at the regional and state level. We need our federal government to reinvest in participating in solutions toward addressing homelessness and housing, and not in it's the person's fault that they're homeless type of way, which is a knee-jerk reaction, I think, for people who are appalled or sort of personally uncomfortable with what they see on the streets. We have to be much more strategic about what we're doing to support folks out there. The next thing I'll say is, we're often asked sort of, how do we think about solutions, because we're putting so much money into the problem and yet our outcomes are worse. They're not wrong. we are spending some resources toward this issue. But relative to what we spend on other city services, frankly, what we actually spend per capita on people experiencing homelessness is actually not that significant relative to county or city budgets. So as a very specific example, only about 5% of the city, and it might even be less than that. It's between 1 and 5% of the entire city of San Francisco's budget, which is about $13 billion, is spent toward this issue. Now, that's what the money we can track. Health Department, the Human Services Agency, the Housing and Homelessness Department. We've tried to create a department to really streamline those resources and get a better understanding of how the dollars are flowing out. But really, if we were going to solve this challenge, we need to understand what we're solving for and then apply the resources accordingly. And it's been really challenging, I think, across the region for us to take the time to do that work and not just sort of do the firefighting approach of the crisis and management. I think it requires a lot more coordination and alignment of what we're actually already doing, and then being able to hold ourselves accountable toward population level reductions in those who are experiencing homelessness today and reducing the new incidences of homelessness over time. And that's some of the work that All Home is really focused on. We want to lift up all of the great work that our CBO partners, that our public sector partners are doing, and we want to engage the private sector, actually. The private sector is, for the first time, really coming to the table around the importance of housing and homelessness. And we want to figure out how do we leverage their interest and assets, both on the housing side. They have workers who are putting pressure on our housing markets. In Oakland, 2 years ago, 52% of the folks who are currently unhoused were housed just 2 years ago. So the rapid nature of displacement that is happening when you had really affordable homes in East Oakland and West Oakland, North Oakland, are now workers who are higher earners are getting into those units. So it inherently pushes those who are already vulnerable down. So we have to be able to, sort of stem the tide of that downward pressure across the region, especially in communities that are rapidly gentrifying, like Oakland. San Mateo, very similar situation. They had almost a 50% increase. They went from 500 people who were unhoused in San Mateo County to 1,000 in 2 years. So the rapid nature of it being a math and economic problem, we have to reconcile and put strategies to work to really think about that. And then the last thing I'd say, and then I really would love to open it up for conversation, is having done this work both on the housing side and on the community development side, we have to look at wages. There's no way that we can have folks earning $15, $16, $17 an hour. These are our janitors. These are the cafeteria workers. These are the contract workers at the large tech companies who keep the lights on and keep the buildings clean. If we don't figure out how to incorporate the stability of those workers into our community, then we will not have a community. Somebody has got to do those jobs. We're going to get to a place where it makes it almost impossible for somebody to commute 3, 4, 5 hours for their $17 an hour job in the city, because they're not going to be able to make that commute. So the shortage of workers is also a consideration that we're trying to exploit with the employers, to think about how do we redesign the economy to really bolster and create mobility opportunities for our lowest wage workers, to ensure that they have a foothold in the Bay Area as well, and that they have an opportunity to not only start out as that barista who is servicing the tech company, but also may want to become a manager or may want to actually go and work for that company someday, but have absolutely no pathway to increase their earning potential or have that support because their housing is so precarious, and they rely so much on that income to even think about skill development or education. So we are really bringing together housing and economic security as one of our goals at All Home, because we think those things are inextricably linked. If you are housing insecure and your job is not paying you enough resources and one of them goes, it is all bad for that household. And that is happening for more and more folks across the region. So I will stop there, and maybe we can open it up for conversation, Robert.
Great. Please join me in thanking our students for their comments. That was terrific. And the floor is now open, and people joining us online also, please feel free to ask questions. So, yes.
First, thank you very much for the very inspiring talks. I think you mentioned about the economic issues surrounding homelessness, like prior to these people become homeless. And then in your speeches, you mentioned the fact that you're kind of trying to providing a shelter for these people is very important. But I have the impression that's only part of the solution, like providing these people the opportunity to get a job or like have some vocational training because they've been out of the workforce for so many years. For me, it's the biggest challenge because you need people to train them. Whereas for housing, you just need to have the building itself. Isn't that?
So just to repeat the question, the question is, don't we also need to provide training for people if we want to help them economically, not just housing? What would you say?
So become financially independent.
So I would answer this in two ways. The first is 40% of the ELI population are already employed. So we're actually not talking about people who don't have an attachment to the labor market. There have been disruptions in the labor market because their housing is precarious. So our theory is if you stabilize the housing, people are actually able to stay consistently employed. And then we have a ton of workforce providers in our region and in our communities that if a person wants to increase their skills, if they want to pursue an educational pathway, there are actually opportunities there. There are a couple of linkages that are broken. One is the workforce programs are not directly connected to jobs. So we would want to get the employers involved on the front end to ensure that the ELI folks who are housed or end up actually in a RV or in their car, but they're still working, that we can figure out how to increase their income within their existing employment pathway so that there's opportunity for them to stay housed while we intervene on the housing side. So right now, those two things do not exist. And in fact, the workforce system is just like many of our systems, is completely siloed from our health system, from our housing system. And so we're trying to make those connections so that those that are able to work, and I think work is also interestingly defined. We also believe that just because you are formerly homeless or chronically homeless, that there is value. There is value that you can offer, whether it's volunteering or what have you. So those who have permanent disabilities, who are chronically in need of that lifetime support, still have value to offer and do work-like activities. And those who are actually able, our young people, a lot of our youth are actually able to work and want to work. And so I think, again, the segmentation of both what the specific needs are for the actual people and creating opportunities for, if you are chronically homeless and unable to work, we have a solution, both housing and sort of social mobility opportunities for you. If you are someone who has earning potential and there's opportunity there, we want to create those pathways. So I think the point is that it's not a monolithic system like we've been managing it. We have to get a lot more customized in terms of how we're linking what people actually are skilled to do with employers who will get them to work if they're not working, and then creating mobility for those who are.
We have a comment online.
Yeah, so we have a question from one of our students who's joining us from South Africa. Her name is Camille, and she's asking, having said that racial divide is one of the main driving forces of homelessness, what are the ways that in your context you may aim to address this?
So, how to address racial divide here from someone in South Africa?
I mean, I think the first thing is to acknowledge it, right? That we tend in this country to like to pretend that and I will say in this region, like, oh, we're all good people, this, and that that structural racism exists. It's in our policies, it's in our practices, and by ducking our head under the table is not going to get us to a solution. I think that we need to sort of interrogate all the different ways that structural racism rears its head and take that on, both not just in individual behavior, but the thing about racism is that it affects sort of policies and practices. It's not just about like, this person's saying something racist to that person. It's that, is that we still have tremendous, because of the long history of redlining, our communities remain incredibly segregated, and we have tied our school system and our resources towards those schools to those segregated housing markets, right? And so we have, it's not just an income gap, although there is an income gap. We know that Black women make much less than white women who make much less than white men, all of that. There's an income gap, but there's also a wealth gap that we never speak about. And one of the things that wealth in your family or in your social network can do is it can protect you from a downturn. So what we find, for instance, when we look amongst people who experience homelessness, people who are white and experience homelessness tend to have much greater amounts of what we would call individual vulnerabilities. So because folks who are white in general have so many more protections, that you can have many more issues and still be protected from homelessness, where there was this myth out there that people who are homeless are disconnected from their families and their friends, and you start to see these responses of like, oh, if we could just connect people with their long lost family on Facebook, that's the answer. When we talk to folks in the Black community who are homeless, they're very connected to their families. Their families are out there helping them every day. They're connected to their churches, to their families. It's that their families are so much living in the same difficult circumstances where they know that they're one small mistake being away from being evicted. And that mistake, by the way, is having someone who's not on the lease stay with you. I own my house. So as I like to say, I live in deeply subsidized housing. You guys are probably aware that the by far and away biggest federal housing support in this country is through the mortgage interest deduction. My husband's an attorney. I'm a physician. We bought our house, and we have this huge federal subsidy because we don't pay taxes on the interest for our mortgage, right? Now, the reason we were able to buy a house has everything to do with family accumulated wealth, right? I didn't have crushing debt when I came out of school. I went to really, safe schools with every amount of resources you could imagine. I went to fancy colleges. I made a good income. And by the way, when I went to buy my house, I sort of went around to my family members and people ponied up $5,000, right? And then like everyone ponied up money and I got a down payment. I have no illusions that if I were Black, none of those things would have happened. And yet the federal government subsidized my housing. Why would you subsidize my housing? Like, I am a physician, my husband's a lawyer. In what kind of world would you subsidize my housing, but not subsidize the housing of my patients? Or, and so I think it's really important to remember that, for instance, housing assistance in this country is not an entitlement, rental housing assistance, that there's something people have probably heard of, Section 8, the official name is Housing Choice Vouchers. That's a voucher you can use on the private market. You pay 30% of your household income. The government pays the rest. We know that only 1 in 4 households that qualify for that get that. It's not an entitlement. There's literally a lottery. And yet, anytime a rich person buys a house, you get your mortgage interest deduction. That is a racist policy, let's be honest. Like, who owns houses in this country? And it's not a coincidence of who owns houses in this country. So I think to address this, we're going to need to actually have an honest discussion about things. I often will start talks by saying I live in subsidized housing, and you see this sort of like uncomfortable look in the audience where they're like trying to figure out like, oh, that's because like I don't look like I live in subsidized housing, but any of us who own our houses live in subsidized housing. it's the folks who are doing the important work in this community who are living, working on the minimum wage. They do not own their houses, and the fact that members of the Black community don't own their houses has everything to do with very laws that were written into our, and so I think that the answer, it's a long answer to say that we're going to need to have an honest conversation and some really uncomfortable conversations, and to think about it differently. And I think it's the onus is on those of us who have gotten the unearned advantages of white privilege to actually do this work, and to just be really honest about it. I don't think this is going to be easy to solve, but I don't think there's any other way through this problem.
Yeah, I was just going to say, it's always nice when the Black lady doesn't have to raise the racism problem. And just to say, I think it will take allies and people having a different understanding and ownership of this issue and how it actually affects not just the people you see on the street or who you imagine to be poor or homeless, but that this structural racism is actually permeating our air. It is so entrenched in how we do our society that it's really hard for people to take responsibility and figure out where to intervene. So it's really helpful when you have folks who are not people of color leading those conversations. I think it creates opportunity.
Yes.
Sure. So first of all, I wanted to thank Columbia for hosting this event. I think it's a start. I think education needs to be part of the conversation going forward. It used to be, prior to 1978, 79, when health and human services used to be health, education, and welfare. They took the education part out, and I think that was a big problem. We've seen homelessness increase every year since then. Part of my concern or question, maybe you could give me some additional feedback or is HHS, Health and Human Services, they have an office in San Francisco, and they have another agency called SAM-HSA, and that's based in San Francisco, and the other office of that department is based in Chicago. There's two departments. In 2016, they had over $200 million budget. And some of the, I think Tomiquia, right? Mm-hmm. Some of the concerns that you brought up was this collaboration and regional level. That's all being done with the federal government. All these, they have a thing called health surveillance, which they document when people are homeless. When you go in and you put your name on the list, the federal government has all this information. It's called health surveillance, and that was the budget. It's over $200 million. So what are the obstacles of getting state health and human services and the federal government to the table along with education and saying, hey, we have the tools to solve this. If you have the information, why are you not sharing that with us so we can make living, cost of living for everybody better? Do you have any feedback on what the obstacles are of getting, at least education's here and they're hosting it, and I appreciate it, and both the guest speakers have been well prepared, and I really appreciate that. But what are the obstacles with federal health and human services and getting them to be part of these conversations? Because I've been to 3 or 4 meetings just the last month, and maybe I'm wrong. Is anybody from Health and Human Services here? Why are they not part of this conversation? And they have this budget that they just, what do they do with this budget?
So just repeat the question. What are the obstacles to Health and Human Services federally working with the states in the role of education?
I mean, I think it depends on the administration, obviously. But I mean, they are, Health and Human Services, certainly our branch at the state level has been very, very involved in these issues. And you'll see in the governor's proposal last week, sort of a redoing of CalAIM, which they just changed the name to Muchacha. Like they keep changing the name of it, but it's basically the state Medicaid waiver program to tackle homelessness really sort of directly. And certainly at the federal level, they are at the table. I think in the current administration, we're facing some extra challenges. But they certainly are at the table in these conversations. I actually think that problem has been that there's so many problems, but we fund healthcare in this country quite well. We spend a lot of our money on healthcare, and we spend demonstrably less on things, what we like to call the upstream determinants, or things like housing. And so some people feel like the answer to that is to get things like the state Medicaid system to pay rent. I personally am not thrilled with that, only because I think there's a lot of excess in the healthcare system. That excess does not live in the Medicaid system, which is the program for the poor. That's not where the fat is in the healthcare system, but that's like a longer, more arcane conversation. But I do think that we have a country that is very happy to spend untold money on healthcare. But we know that healthcare determines such a tiny proportion of health that most health is not, you could have a perfect healthcare system and make a tiny bit of difference in people's health. And that what really determines people's health are these other things: your educational system, your housing, your other, your level of income inequality, et cetera, et cetera. And so I think that HHS is at the table to the extent that they are. Obviously, this administration on the federal level is a little more challenging. I think the issue is actually, how have we decided to fund healthcare to the nth extreme? Like, there's really no end to what we seem like we're willing to spend on healthcare, and we are as a society so unwilling to spend money on these other things that are actually probably much more predictive. If our outcome we want to get to is health, I would spend money on housing long before I would spend money on another treatment.
Yeah, and I guess I would just add that, the state has actually, before this administration, did not really prioritize housing as one of the governor's key priorities. And so you had in 2012, for example, the really only mechanism that the state had, which was redevelopment, to fund affordable housing across the state, be abolished, and without a permanent source to replace that. So we've been constantly trying to figure out at the local level, at the county level, how to actually pick up the slack for what the state was not investing through its redevelopment dollars. The federal government has been disinvesting in housing for the last 25 years. So if you have health and human services and education and HUD at the table, that's cool. But if there's no more money, it's not helpful.
It's not the table,
and
right.
when you have the same pots of money being distributed in ways that aren't cohesive and aren't sort of thinking about the social determinants of health, then you kind of get this fractious outcome that we have now. So we're trying to, the new administration, and it's not to say that Governor Brown didn't care about housing, it just wasn't a top funding priority for him. And we've been in a housing shortage for about 40 years in the Bay. Like, we haven't produced enough housing for a really long time. And so all of the naturally affordable housing we call, which were, 2, 4, 6 unit homes that you could get in, I don't know, West Oakland just 5 years ago for $800 a month, all that's gone. And so we're trying to, and this governor is very much at the table around working with stakeholders to reinforce the commitment to housing and address homelessness. But we got to build that infrastructure within the state bureaucracy, frankly, in order to facilitate those dollars to the impact that we actually need to see at the population level. So there's a lot of trickling down, and we got to cut the fat out and actually figure out how to tie that money back to the community.
And you
Great
can,
answer. Thank you.
Of course.
Forward back, yes.
The yellow?
Yeah.
So I want to kind of dovetail on that. I think I'm resonating with a lot of what you're saying. And it's interesting for
Just
me.
speak loud if you don't mind.
Can I say louder?
Yeah.
Louder? Okay, I'll stand up. It's interesting for me to hear what you're saying from, like, kind of a macro level, because I've been an organizer on the ground for about 10 years. So I live in the East Bay. I now live in West Oakland. I've been there for about 10 years. And I've been pretty invested in this particular set of issues for the duration of that time. My uncle lives with schizophrenia. He was homeless. That's kind of what got me into all this. So what's resonating with me is what you're saying about needing to, like, de-silo, right?
Yeah.
That resonates strongly. That the systems need to be talking more. I think we're living in a culture that's extreme, like, really averse to anything that feels like socialism, and it just feels like that's like grinding the gears, trying to have that conversation about how do we communicate better, because this isn't working. That being said, I think, what's my question tonight? I've kind of swung from working on issues related directly to affordable housing because of what you're saying. It's like we haven't been building this for a really long time, so kind of pushing that ball forward of, like, we've got to build. Like, the next decade has to be build, build, build. So now I'm swinging to like mental health issues. So I'm teaching mental health first aid classes, I'm talking about health issues, and I think what you're saying is true. Like the medical issues are lesser in the pot. Even so, I've started pushing things up to the state level of like, this interface between Medi-Cal and Covered California doesn't work.
Yeah.
So that's
Right.
producing an extra set of time and energy and money that could be going into something else.
Absolutely.
Right? What would you say about your perspective on how the mental health care system needs to be reformed? Because I feel at loose ends about that. I'm like, it seems like a total mess to me.
So how does the mental health system need to be reformed?
I mean, there are so many, I mean, it's sort of like to say all of this doesn't say that the mental health care system doesn't need reform, because it does. And I think one of the issues is that we have completely separated mental health from physical health, to the extent that I don't know if people are aware of this, but like if I have a patient on my service and I'm in the hospital and that person develops a problem and they need an operation, I literally call the surgeons, they come by, they wheel the patient down, no big deal. If that person has a mental health crisis, I have to, on the books, discharge them from the hospital and readmit them to the psych hospital. Yeah, it's because the payment systems for mental health care and physical health care are so divided. There are all sorts of the Medicaid, how we fund, and I think some of the disorganization and chaos comes actually directly from this segregation and how we pay for it. And that's just like one example, but there's all of this arcane things of the way, and I don't know that most people are aware of this who are not in the field, but the way we pay for mental health care is completely separate from physical health care. And even though we have a law in the federal books that there's supposed to be parity in insurance, there's not parity in insurance, and their ability to access mental health care, particularly for low-income folks, is abysmal. And frankly, even for high-income folks, it's not so great either. But for low-income folks, it's abysmal. So there's nothing that I said was meant to imply there isn't a lot of work to do on the mental health side. It's more that were we to perfect the mental health side and not fix the housing side, we would not be able to fix homelessness. And so we could do all that we want to perfect it. It would help a lot of other things, by the way, but it wouldn't help the problem of homelessness. And so we need to be working on both together, because this really, it's a workforce issue, it's a payment issue, it's a how we pay for services, it's how we access services, is really, really, really challenging. And actually, one of the things about mental health disabilities is it makes it harder to navigate complex systems. And so we build the most complex systems for people whose very disability makes it harder for them to navigate these services.
Yeah, I guess the only other thing I would add is that we are, although to Margot's earlier point that you don't want to have Medi-Cal or Medicaid dollars pay for housing, you should attach your services to the housing that is being built for people who have mental health disabilities. So we forever have been trying to figure out how do we help Medi-Cal align with supportive housing projects so that developers are incentivized to develop the housing, but they need dollars to operate the services. And so we want to make much better linkages between those two systems in order to ensure that we get more of the housing built for that 10 to 12% of folks who have mental health disabilities, who are a part of those of our neighbors who are unhoused, and how do we tie that to accelerating the production of more ELI housing?
Because as you can imagine, that's right now, the systems are not terribly aligned.
No.
Virginia.
So I think my question is primarily for Tomiquia. I'm an Oakland resident of 25 years. I've seen firsthand how horrible the homelessness crisis have become. So I live next to a very large empty dirt lot.
Yeah.
You probably know where it is, 51st and Pleasant Valley.
Mm.
There are many of these in the East Bay, and there are many groups in the East Bay working on things like tiny houses. Not a permanent solution, but a decent temporary solution. Why can't those types of empty lots be used to put those tiny houses on? are there laws on the books in Oakland that are zoned against it, or is this a not in my backyard issue?
So why not use lots, and maybe just say what a tiny house is, because some of us may not be familiar with the specifics.
So it's literally a 100 or 150 square foot residence. Many of them now actually have a bathroom and a living space. And in some communities, they are being used for permanent dwelling units where people actually live long term. In other communities, they're using those as temporary housing solutions to bring people indoors, and then they're finding longer term permanent housing options. So that's what the tiny homes are. And, certainly Seattle and others have done Portland have done large-scale demonstration projects of tiny homes in their communities. I guess I would answer your question in two ways. The first is yes, there are a lot of zoning barriers to having parcels of land that are zoned for not residential purposes actually be rezoned for residential purposes. So and to be clear, most of California is actually zoned for single family homes and not multifamily apartment buildings. So more than 65% of the entire state is zoned for single family homes, meaning you can't build more than a single family home on that parcel of land. So the NIMBYism, the not in my backyard phenomenon that is rich and ripe in the Bay Area, is paired with actual protections around our land use policies that continue to perpetuate those challenges in communities. So the fact that jurisdictions have to fight one project after another, where you have to negotiate with your city councils and the groups who are opposing those projects, that also attributes to a slower production pipeline. You're not able to get creative solutions like modular, like tiny homes, a variety of other building typologies, and that's what All Home is trying to do. We're trying to be like, hey, how do we help Oakland move those barriers out of the way? Work with public lands. A lot of those lots are either owned by private landowners, or they might be owned by public institutions. So they might be owned by Caltrans. Caltrans has actually been working with Oakland to temporarily provide the cabin communities on Caltrans property. The governor just put state lands as a priority to accelerate emergency housing solutions across the state. So we are sort of understanding what land is actually available. How do we convince the property owner to negotiate with us around temporary solutions? And most of the time, those landowners, if they agree, want sanitation services. They want, security. So those dollars come from somewhere. And in Alameda County, the county actually has those resources, not the city of Oakland. So the city of Oakland is putting a lot of cash, as much, and y'all don't know, but Oakland actually has a structural deficit in its budget, which means that the tax revenue that comes into the city of Oakland is not actually enough annually to cover the cost of operating the city. So that is a structural barrier, even in these times, that Oakland contends with every budget cycle. So when everybody's like, why don't you just deal with the homeless problem? Put more money toward the issue. What is Libby Schaaf doing? I'd be like, for real? How about we do a little public financing education so that people actually understand what the limitations are to jurisdictions who give a damn, who are doing the best they can, and the partnerships that are required from the other governmental agencies, like our counties, like our state, and like our federal government, that actually makes it work. So those are some of the things that we're actually leading to, and part of the reason I created All Home is because there is no organization that is at the intersection of this coordination, systems change, and actual solutions. And that's why we're really working very closely with the city of Oakland and Alameda County to push through some of these barriers.
Samir, there's another online question.
Yeah, so we have a question from Anne, who's joining us online. It's a question for Margot. And she asks, while housing first is an essential part of the continuum of care for the homeless, do you not agree it is just an important part? For example, many cities stopped funding shelters when housing first came into place, but now we cannot build housing fast enough and people have nowhere to go.
Yeah, this is a great question. So the question is really, for instance, when San Francisco really leaned into permanent supportive housing, they did decrease the number of shelter beds. And so, so some of you guys are New Yorkers. Who has a worse homelessness problem in terms of proportion of the population, New York City or San Francisco? What's that? Or LA, New York, or San Francisco? Who is a worse?
San Francisco.
New York has a higher proportion of their population who's homeless. New York has a right to shelter law, which means anyone who shelters, and this happened from the late 70s, that if you're homeless, the city has to provide you with shelter. Now, that's good and bad. I'm actually will go on record as being against right to shelter laws, and I'll explain why. Partially, New York City spends about $35,000 per person per year on shelter, and so they're never going to get out from under that. That being said, I agree with Anne that California has probably gone way too far in the other way. California, it's about 68% unsheltered. LA is 75% unsheltered. That's obviously too far. I mean, we can't have people, we had a big hepatitis A outbreak, and we have people freezing, which is just unacceptable. And so the answer is, how do we rebuild what we call our while we wait, or our crisis response system, while not diverting so many resources there that we never get out from under it. And I do worry that the easiest way to make everyone think that we have a less of a bad homeless problem is to just build huge warehouses and stick everyone in, right? Then everyone would answer. Most everyone here thought New York is a less bad problem than the Bay Area and LA. New York has a higher prevalence of their population who's homeless. It's just that you can't see those folks because they're in shelter. Now, when I talk to folks who are unhoused, usually, not everyone, many people would prefer shelter to being unsheltered. Not everybody. And it really depends on the shelter, and it depends on how you build your shelters and how you manage your shelters. But everybody would well prefer housing to shelter. And the problem is, if you create a lot of shelter and you don't create housing on the other end, you quickly fill up those shelters. And then you have a large sheltered population, but people are still falling into homelessness and people aren't exiting it. So there are ways to design shelters so that they're laser-like focused on getting people housed. And, we talk about the 3 or 4 Ps, the 3 Ps being pets, partners, and privacy, that people will not, the way most shelters exist is that you're separated from your partner because they're usually single sex. So almost no shelters allow you to go with your partner. Usually you separate from your pet, which seems like a small thing. But first of all, if you're like me and you love your pets, that's, but also if you're homeless, your pet may be extraordinarily important. And your possessions, you can't bring in your possessions. And most shelters exist that you can stay overnight and then you need to walk around during the day. So San Francisco has created low barrier shelters called navigation centers, which allow you to bring your pets and your partners. They provide some privacy in there. And they and your possessions. You can bring all of your stuff with you, which most other shelters don't allow you to do. I think the secret is we probably need a lot more shelter than we have. But we probably want to resist the temptation to throw all of our resources into managing the problems, because what shelter does is they manage homelessness, they don't end homelessness. So there's probably some halfway point that we need to find. There's no question that we need more shelter, and shelters done well can be an opportunity that you go into shelter and you've got a short period, you're in a crisis, you go into shelter and someone is there saying, okay, let's get your paperwork in order. Oh, wow, you actually qualify for unemployment benefits, but you weren't aware of it. Or, wow, you qualify for this job training resource, or and that you quickly then say, let's get you out of here into housing. That's not the way most shelters in this country work. That's not the way they work in New York, where people are stuck there for unbelievable lengths of time at extraordinary cost. But one could imagine us doing better in California. Probably having 68% of your homeless population unsheltered is a terrible thing. But I do worry a little bit that San Francisco could or the California could say, like, great, everyone's in shelter, and then everyone be like, oh, we have no problem, and then people are languishing in shelter. So there's some midpoint. But I agree completely that the pendulum probably swung so far that we lost that important part of what I think of as part of the crisis response rather than the solution.
So I want to come back to political will for a moment. It seems that a lot of this, or a certain amount of hinges on generating more political will. Any thoughts or suggestions on how we might do that?
So the way I think about that is, politicians unfortunately have the burden and opportunity of driving these very significant entrenched social problems in 4-year increments or 2-year increments, right? Where you have to announce something big and sweeping and generally it's top line, the sort of bureaucracies that need to support the platforms that our elected officials run on, move very slowly. So it's really difficult, I think, to have the social issue of our time where we're talking about wealth inequality, homelessness, housing shortages, and income inequality in the hands of our politicians to drive the agenda. Because there's always going to be motivation to try to solve what people believe you can do in the time you're in office. These challenges actually need sustained, strategic, accountable pathways to actually ending them. And I have worked for many politicians. I've worked in government for a really long time. And unfortunately, I don't think the environment of our electoral politic allow for politicians to own solving these crises. So you do maintenance, I can get 1,000 units built, I can get 1,500, I can unlock 1 billion, whatever, all good things. They are necessary but not sufficient. So I think that our community stakeholders putting pressure, frankly, on the bureaucracies, the people who aren't turning over every 4 to 2 years, the department heads, the counties, the state governments, the federal governments. The HUD staff before Obama was there 2 administrations, 5 administrations. How do we begin to penetrate the political bureaucracies or the public sector bureaucracies to actually begin to shift? Housing First is a really great example. Housing First, that was then led by the Interagency Homelessness Council, was then applied to the Housing Department, was applied to the Human Services Department. So these policies get generated from community and are able to sort of take hold from the bottom up. And so I think we have to hold our politicians accountable for doing the most they can with what they can control right now, but understanding that the sort of design of electoral politics and how people get work done is outside of that scope. So I think it's really important for us to, when we say political will, or at least when I say it, I want this governor to understand that homelessness is actually solvable and that we want to help him and the state organize itself to put the right things in place to start working toward solutions, not management. And so that's the difference between how a politician often has to approach this work and how those of us who've been in it for a really long time try to approach it from a systems perspective.
I will say the other thing to co-sign all of that, and I feel like we are constantly like inverted who we're like, there are things that are under local control, there are things that are under state control, there are things that's under federal control, and we pummel mayors on this issue. Mayors take all the heat for this issue, and very little of this problem is actually under their control. We pummel governors a little less and a little more, and we pummel the federal
the least,
and they're really the only ones who can solve this problem. They're the ones who created this problem, they're the ones who can solve this problem. And I mean, Tomiquia and I are sort of housing nerds, right? So I've been following every election, every debate, for 25 years. These are the first set of Democratic debates where the word housing has even been mentioned. People don't even, people we elect to federal roles, either Congress or Senate or the presidency, never have to speak about affordable housing. And mayors lose elections all the time. And I actually I spend a lot of time with mayors, and not as much as you do probably, but I spend time with mayors and I feel incredible empathy for them because they're the ones who their constituents are screaming at them and not reelecting them, and we are letting our federal decision makers completely off the hook, and they're actually the ones to solve this. I think likewise, we're not good at saying like local folks can control certain like land use things and zoning things, which are really important, but we scream at them about money. And that, you know what I mean? We're like screaming at the wrong people. So I think we need to build, I think we need, you know, people sometimes ask, sometimes I speak to like audiences of like, you know, I go to these events where they're like people who are sort of well educated and wealthy, and they're like, what can we do? And I usually say there are a couple things you need to do. One, you need to believe that this is solvable, because if we don't believe it's solvable, like we will never solve it. I can't guarantee you that if we believe it's solvable, we'll solve it, but I can pretty much guarantee you that the second we decide this is unsolvable, will be unsolvable. Or as one of my Kenny Prayers, he's this fabulous person on my team, he says to me, Margot, he's like this big guy, he's totally enthusiastic, he's like a giant peppy dog. He's like, Margot, when's the best time to plant a tree? And I was like, I don't know, Kenny, when's the last time to plant an oak tree? He's like, 200 years ago, Margot, 200 years ago. I was like, okay. He's like, Margot, when's the second best time to plant an oak tree? I was like, I don't know. He's like, today is the second best time. We are like way behind on this, but we need to plant that oak tree now, and the way we plant that oak tree is to demand accountability at every level of government. So the first thing is, I often say to wealthy audiences, you guys are donors to political candidates, you talk to political candidates. I don't want you to have one conversation with one political candidate at any level of government, particularly the federal level, where you're not asking them, what are you doing to solve the ELI housing crisis? That's the first thing. The second thing is, one of the things that I get to do in my job is show up at community meetings when they're trying to cite some services for supportive housing or for shelters or whatever. And I go because it's kind of like part of what I do. Trust me, every single person in that community who doesn't want that to happen is there wearing their matching t-shirts, carrying their signs, hurling curses and yelling. All of my neighbors or other people who are like, yeah, of course I wouldn't mind having supportive housing near me. That, you know, and I get it. I've got kids. I usually have other things to do on a Tuesday night too. But like those of us who are tacitly in support of it don't show up. So my second thing is, the answer to any kind of affordable housing is yes. And just thinking yes isn't enough. You need to show up and say yes, and you need to let your elected officials say yes. So the three things are: believe you can solve it, demand accountability at every level of government, asking in every debate you go to, everything, particularly at the feds, but all the levels, what are you doing about this crisis, in being informed about what will work. And the third is to say yes to dense housing, low-income housing, affordable housing, and not just say yes in your head, but actually show up and say yes. Because trust me, the people who say no are not silent. They're very motivated.
Unfortunately, we're out of time, but we have a reception. We have food. I hope our speakers will be able to hang out for a while and answer other questions that may come up. Those are very powerful and inspiring words. I think you've opened our eyes, both of you, to important ways. So please join me in thanking Margot Kushel and Tomiquia Moss for their wonderful comments. Thank you for joining us. FYI, we'll be having other events. Also, I'm speaking at the Commonwealth Club, if you're interested, on Wednesday at 6 p.m. on a new book, a different topic, Designing Babies, how technology is changing the ways we create children. So we in bioethics go from human basic lives to digital lives. So again, please join us for reception. Thank you all for joining us, and thank you both. That was great.